There's a great study that came out in April of 2024 that supports what I've been saying for a really long time. Hey, that's what the immune system is for. That's why we want a healthy immune system. It cleared it up without the use of antibiotics. Over 85% of dogs and cats after age 2 have some sort of dental disease, whether it's gingivitis, plaque, tartar, loose teeth, broken teeth. We really have an epidemic of dental disease in our household pets. Part of that is because we don't really think about it when they're young, and so we can be a little lax on dental care, dental prevention. And depending on the breed of your dog or cat, they may be more prone to dental problems than others. Large breed dogs tend to not have as much trouble as small breed dogs. So it's really important that we stay on top of this. I personally have 2 young dogs who are 3.5 years old. Forrest Gump has a Jing deficiency. Actually, so does Gilly, which, for those of you who've been following me, that means that they were born as the runt of their litter. They've got neurologic problems like hydrocephalus, syringomyelia, caudal occipital malformation syndrome. And when they have that, it also affects their bones and their teeth. And so they have really poor quality enamel. They're very prone to building up plaque and tartar, loose teeth, broken teeth. And so we have to stay on top of those things. Forrest, at the age of 3, has already had 3 dentals. He's been getting one every year. And they're anesthetic dental cleanings because that's what it takes to be able to do the x-rays and really know what is going on under the gum line. Now, every time one of my animals gets a dental, when I pick them up, I'm handed a bottle of painkillers and a bottle of antibiotics. There's a great study that came out in April of 2024 that supports what I've been saying for a really long time. These animals do not need to have an antibiotic injection or be sent home with antibiotics after having a dental, even if they've had extractions. I personally always turn down the antibiotics. I'm going to read you some information about a study that came out that supports my position. Bacteremia, which means bacteria found in the bloodstream. So if we do a culture of a blood sample, we can find bacteria in there. Bacteria in the bloodstream is commonly found after dental scaling and oral surgery in patients with severe periodontal disease. So these are those dogs that you see that have tons of tartar, loose teeth, inflamed swollen gums, and painful mouth. These are the worst of the worst. So these are the dogs that they tested. And the aim of the study was to assess whether that transient bacteria in the bloodstream developed after dental scaling, root planing, and dental extractions, as well as whether the amount of bacteria in the bloodstream warranted the use of antibiotics. Client-owned healthy dogs with mild to severe, so all different levels of periodontal disease, received a complete dental cleaning with root planing and extractions as needed. Blood culture samples were collected at the time of IV catheter placement. So this is before they're sedated, before the dental. 5 minutes after the initiation of the dental procedure, 5 minutes after the first extraction, at the end of the procedure, and 1 hour after the procedure. So they have now taken 5 blood samples on these dogs and cultured them to see how much bacteria was released from that dental cleaning, from all that nastiness going on in the mouth. Bacterial growth was noted in almost 40% of blood samples across all cases at any given collection time. No bacteria in the blood was present in samples collected before the dental cleaning or 1 hour after the procedure, indicating that bacteria detected during the procedure resolved within 1 hour in the absence of antibiotic administration. So the body took care of it. Hey, that's what the immune system is for. That's why we want a healthy immune system. It cleared it up without the use of antibiotics. So the authors concluded that these findings do not support the use of pre, peri, or post-operative antibiotics for dental procedures in otherwise healthy patients. Now, if you happen to have a dog who has mitral valve disease and they've got all those extra growths on the leaflets of their valves, maybe we could make a case that those dogs might need antibiotics, but not in all of them. And so this is really important to consider. Do we routinely use antibiotics? We have doctors that routinely administer antibiotics for a spay surgery or a neuter surgery or a mass removal. It's really not warranted. There's no bacteria in the bloodstream. We're supposed to be doing sterile surgeries, and even if we did introduce some bacteria, the body takes care of it if they're healthy. What this says is antibiotic therapy may be warranted in dental patients with certain conditions, like heart disease, immune system compromise, so if they're on Apoquel, Cytopoint, steroids, other immune suppressing drugs, metabolic disorders like diabetes, especially if it's not well controlled, because the high blood sugar is going to encourage the growth of bacteria. And so we have to base it on clinical judgment. But for instance, Gilmore and Forrest, who just recently had dentals and they both had extractions, did not get antibiotics because they are otherwise healthy. So really think about it, have a conversation with your veterinarian about whether they need to be used, because antibiotics are overused all the time. They can have severe side effects. They're going to wreck the microbiomes of the body. The respiratory microbiome, the skin microbiome, the digestive microbiome. And we don't want to keep wrecking these things. We want to allow the immune system to do what it needs to do. Really think hard about whether or not you want those antibiotics, whether your pet needs them, whether they have secondary conditions that might warrant it.